Hi, I'm David Bowman, a financial advisor and a 30-year resident of Murphy's. When you live in a small town like ours, it becomes really apparent how important it is to support and have access to services, especially when it comes to choices in healthcare.
I'm Gloria Miller, David's wife, and what we thought was going to be a routine day last September turned out to be not so when David was dizzy and came home early from work saying he was just felt a bit off.
2 evenings later, it got really serious. I was doing some music at church and got so dizzy I thought something is really wrong with me.
And that's when we realized that things had taken a turn to be a little more serious. Into the car, down to the ER at Mark Twain Medical Center.
We arrived about 9:30 that evening, and it took several hours, but they got me admitted quickly and ran a whole battery of tests and sent me home. They felt that they had me stabilized.
But by Saturday morning, David had relapsed so severely that we got him into the car and headed down to James Dalton Medical Office in Angels Camp. We had a consultation there, which went great, but they did more tests and sent us back to Mark Twain Medical Center ER yet again. They admitted David this time and performed a full battery of tests on him. They even had a cardiologist, neurologist in Sacramento, sort of like they called it a robot, but it's telemedicine doctor to rule out any neurological issues.
They finally diagnosed that I had a viral infection in my inner ear, which was causing this extreme vertigo. And they assured me they knew how to handle this, and so I spent the next 3 nights at Mark Twain Medical Center, and they were wonderful. The staff, the nurse, the physicians, the techs, everyone was just wonderful. And by Tuesday, from midday Tuesday, I was discharged, feeling much better.
Yeah, which was great, but our ordeal was not yet over. On Thursday, David began having pains in the middle of his chest. And so back to Mark Twain Medical Center emergency room we went for a 3rd time in a week.
The physician there immediately diagnosed that I had a gallbladder that was highly infected and needed emergency surgery. So I was scheduled for surgery the next morning, which was a Friday morning. And again, the physicians, the surgeons, the anesthesiologist, all the nurses, the tech were amazing. The surgery was late in the morning, and by 7 o'clock that night, I was home enjoying a root beer float, feeling 100% better.
Throughout this 11-day ordeal that we experienced, we kept coming back to the feeling of being blessed to have Mark Twain Medical Center right here in our community and having access to such comprehensive, competent health care.
Yeah, and that's my sense of this, is the proximity and the care and the competence. Right here locally, it's just extraordinary.
So when it comes to your health, having access to and support of our local Mark Twain Medical Center is imperative and makes all the difference.
On the Highway 4 corridor, you have a choice to make when it's time to seek health care. When you go down Highway 4, you can choose to turn left and go to an adjoining county. Or you can go straight and head to the valley. Or you can turn right and go to Mark Twain Medical Center with all of its resources. We are so glad that we chose to turn right, and we think that you should consider turning right as well.
Hi, I'm Doug Archer, and I'm the president and CEO here at Mark Twain Medical Center. I want to take a moment and say thank you to Dave and Gloria for sharing their great story. I also want to thank them for choosing Mark Twain and turning right. And we hope that if you're in need of medical services, that you will also turn right.